My name is Jamie King, also Hyun Joo Kang, and I'm the dental director at KCS. How I came to be an employee of KCS is very interesting because after graduating dental school, which I at Western University of Health Sciences is where I went to dental school. We did a lot of outreach programs and we learned a lot about FQHCs. And so my want was when graduating, I wanted to work for FQHC as a dentist, and I was looking around and I came upon an ad with KCS hiring a dentist. So I was like, oh, this is awesome. It's like not relatively far. And I started part-time as a dentist and then a few months later as a full-time dentist at KCS. My motivation to become a dentist was actually something that came later in life because when I was in high school, I was interested in a lot of things, but dentistry or the medical profession was not one of them. I wanted to do research, so I went to University of California, Irvine to do my research in biological sciences, and I went towards that goal. And so when I went with that mindset into research and going to my PhD program in the Midwest, I realized that that was something that really came to me in a way to see myself in the future. And so after getting my degree, I think having this research background is great, but also having a skill of being a dentist would be something that would be very beneficial for me. And so then I started planning on going to dental school at that point. I think I'm different than the average dentist because I came to become a dentist at a later age in life. And so I feel that I'm able to empathize with the patients more and help them with their anxieties if they have it. When I had anxiety as a kid, that whole thing can really put an impression on a child later on in life to see if they will go to the dentist or not and get good oral health because their ability to deal with the dental office and things of that nature. So because of my background, I think it helps ease a lot of patients when they're in the dental chair at KCS. So one of the things that for pediatric patients and their parents to be aware of for oral health is that the kids, if they don't do a thorough job of brushing, it definitely shows when they come to the dental office, and hopefully they come to the dental office to have the dentist explain to them. But a lot of times, families, they're busy, the kids are busy going to school and after school activities, whatnot. And so one of the things at an early age they have to get used to is brushing properly and brushing for a good 2 minutes. It's really bad for kids to have a bottle in their mouth before going to bed because that really does a lot of things in the mouth that is negative for the kid and for their permanent teeth later on. Also, this is something that parents don't know. When the parent shares their spoon or utensils with the kid, and a lot of the times when they're really small, they want to make sure it's not too hot, and so they put it in their mouth and then give it to the kid. That's really bad because the adults will have different and many more germs than the kid will, and by doing that they might potentially be spreading the germs that lead to gum disease to the kid right off the bat when the kid didn't even have any. So we at KCS have mobile dentistry, and we have a big van that can go out to multiple places. And The purpose of that is that we try to take the dental office with us to locations where we do not have a clinic, or the patients might not have access to a dental clinic nearby. So we go out to specific locations, and the mobile van, basically we can do most of the treatments that we normally do at the office. However, very time-consuming, extensive work we can't do in the mobile van. So other than that, all the other things we can do in the mobile van, and so it's very comfortable, and everybody says it's really nice inside.